This is an educational video targeted to adults aged 50 and older to provide knowledge on the prevention of HIV/AIDS. You may still have concerns after viewing this material. We invite you to seek out additional information and to discuss your concerns with your health care professional.
I'm at risk. Ah, check, gotcha.
I'm at risk.
I'm at risk.
Sweetie, could you get cheese for me, please?
I'm at risk.
Today, seniors have the advantage of living longer and being in better health than in times past. Advances in medicine have enabled today's seniors to enjoy a healthy, happy sex life. It would seem that today's seniors have the freedom to live their lives to the fullest. But along with that freedom comes responsibility. Unlike in times past, we live in a new era of sexually transmitted diseases. HIV/AIDS is one of the deadliest sexually transmitted diseases that we have yet to discover a cure for. HIV is the virus that causes AIDS. HIV stands for Human Immunodeficiency Virus. This virus weakens the body's ability to fight off disease. HIV is spread from person to person through the exchange of bodily fluids. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the condition caused by HIV that prevents the body from being able to fight off regular, everyday infection or disease.
HIV is transmitted through infected body fluids. Those fluids with the highest concentration of the virus are breast milk, semen, blood, and vaginal fluids.
Not transmitted by friendly, casual kisses, casual contact, talking with somebody in a room, sitting down and eating dinner with someone who might have HIV. Those kind of things do not transmit HIV.
We're seeing an increased number of cases of HIV and AIDS among those over 50.
It is estimated that there might be anywhere from 11 to 15% of the reported cases of AIDS that are 50 or older.
And many of them don't realize that, and I share with them that the numbers are probably much higher due to the fact that seniors are probably the least group that we target for testing. And seniors, like young people, ought to be tested because it takes 7 to 8 years, depending on the person, for the virus to show up. And a lot of seniors are infected, so those numbers that we know from CDC are a lot higher from the lack of seniors being tested and feeling that they need to be tested.
Seniors are living longer, and as a result, they may find themselves living alone, feeling invisible, isolated, and lonely. In search of companionship, individuals may engage in behaviors that put them at risk for HIV.
Yeah, just a minute.
Hi.
Tiffany.
Bought you a few things from the store.
Good to see you. You always do good things for me. Bring you good things.
Well, it's a few things. It's not much. It's so dark in here. Why don't you turn on the lights? Brighten up this place.
Well, look, did you get that thing straightened out with your landlord?
Oh, I sure did. Thank you. Thank you for helping me out with that.
Oh, I don't mind helping you out. You're so good to me, and I don't mind being good to you. You know that.
Well, I'm starting to have problems with the phone company now.
Oh, is that right?
Have to find a way to deal with them next.
Tell you what. I got my check yesterday. You good to me, and I'm gonna be good to you. And you always make me feel good.
Well, in that case, why don't you come along with me?
Well, the message I normally give to seniors is pretty much a wake-up call because most seniors are in denial. And usually I have to make them aware that HIV relates to them because they figure it relates to only young people. And therefore I have to tie into the activities that they see day to day, such as seniors at the first of the month who live in senior residence. A lot of them have younger people who come and, service them, male and female.
Now, let me give you an example. At the first of the month, we all know that that's when Social Security checks come. And at that time, there's dispensable funds, and people go out.
You have some seniors who are lonely, who are depressed, who are looking for companionship, and when they weigh the risks of their loneliness and wanting companionship, it tends to override the risk of AIDS and other sexually transmitted diseases.
So therein becomes a risk, not only for the male that might be exchanging this money for sex, but if that male also has another lady friend, that infection could be carried on to that lady friend. And whenever one gets into having exposures with or having sex with partners that one may not know that much about, or multiple partners, then there are various different kinds of risks the person gets into, other STDs, syphilis, and including HIV.
Despite certain social stigmas, many seniors are sexually active and may even participate in alternative lifestyles or non-traditional sexual behavior. These behaviors can increase a senior's risk of contracting and spreading HIV. One such example is the down-low lifestyle.
Hey, what's up, man?
Hey, what's happening, man?
Not much. What's going on?
Not much. Come on in. Can I get you a beer?
Yeah, I'll take a beer. Thank you. How was your day?
It was all right.
Men who have sex with other men and who also have sex with women are creating a particularly troublesome situation, especially for the black community. These behaviors increase the spread of HIV among black women.
Hi. How's it going?
Okay, what do you think?
Men who have sex with men is already a high-risk area. However, there's a new trend, if you want to call it, that's called down low. And those men are having sex with men, but they're also having sex with women.
We have a group of men, African American, who don't consider themselves bisexual, homosexual, or gay, but they have sex with other men. And they consider themselves to be heterosexual. They can be married, they can be with girlfriends, and they will go and have relationships every now and then with men, but then they have a partner who is female. And this is putting the female, particularly African American population, at risk, and the statistics bear that out because females who are African American are greatly outnumber those of other races.
The point being that women have to be particularly vigilant in protecting themselves because they may not know what other sexual activities their man may be engaging in. They think they're in a safe relationship, and they're really not.
HIV affects people over age 50 in numerous ways. Despite myths and stereotypes, many seniors are still sexually active, and some of these seniors are illicit drug users. Therefore, their behaviors can put them and their partners at risk for HIV infection.
Checkmate. Gotcha.
Oh, man, you finally won one.
That was my day.
Look, I've got to roll.
Okay.
You coming by later?
Why? You want some revenge or something?
Of course I do.
Yeah, you got it.
Hey, man, what took you so long?
Oh, man, I got caught up in traffic, and then I went by Junior's house. He didn't have nothing. And, you know,
What
man,
that for?
I was running by.
Substance abuse among older adults, including IV drugs, abusive alcohol, prescription drugs, and over-the-counter medicines, has been called an invisible epidemic. Substance abuse promotes many types of high-risk sexual activities and high-risk behavior. It also decreases the chances that a condom will be used in a sexual encounter. Entry into effective drug treatment may be fundamental to changing these sexual behaviors for addicted patients.
Persons do not stop living once they get over 50. Our mature population is a sexual population. If there are issues or might have been issues of drug use in their past or before the age of 50, there may continue to be issues of drug use once a person hits over 50. And we know that there are persons over 50 that use drugs.
People who share needles put themselves at risk for HIV through blood-to-blood contact. Likewise, they also put others at risk and themselves at risk if they have unprotected sex afterwards. If you're using intravenous drugs, your mind is a little cloudy and you could possibly have unprotected sex and infect someone else or likewise get infected yourself.
Many seniors, though healthy and vibrant, find themselves divorced or widowed, and surprisingly back on the dating scene, and involved with people whose sexual history is unknown to them. According to the Centers for Disease Control, sexually active older people are less likely than younger people to use condoms, mainly because they don't see themselves as at risk for HIV.
Hey, sweetheart, how are you?
Hey.
That's great.
Thank you.
Same here. A little wine for dinner.
That's good. Thank you.
Last week, Italian cuisine. Week before, Japanese. Tonight has just been terrific. You know, it's been a great evening, but I think tonight you outdid yourself.
You think so?
I really do.
Well, it's been a labor of love. I really enjoy preparing for someone who's special and someone I care about.
You mean you prepared this meal for someone else?
Stop it, kidder. I prepared this just for you.
What else did you prepare just for me?
We can relax and talk about it.
It works for me.
The reason there's an increase of AIDS and HIV among those over 50 is, number one, those who were infected earlier at a younger age are getting older. They're living longer. We find that people are over 50 are engaging in sexual activities with multiple partners, either through divorce or being widowed. And because of that, they really don't know their partners, and they are becoming infected, and they are not getting tested.
Men and women over the age of 50, or at 50 in my case, sometimes find themselves in divorce or find themselves lonely, whereas, again, with this new age that we're in, a lot of us are exercising more and we have a lot more energy to do things. And so life is really like not over at 50. So a lot of us are going out dating at 50. We've achieved all of those things in the corporate world or whatever jobs are, and we've achieved all those things, and we go out and we're looking for relaxation, comfort, a person to share some things with. And we forget that we still need to protect ourselves.
As we get into menopause age, there are changes that take place in the vagina. The vaginal wall becomes thinner, there's less lubrication, so there's more of a potential of tearing. Small tears or cracks may occur in the wall of the vagina during sexual intercourse. That doesn't necessarily have to be excessively rough, and therefore there's more of a potential for exposure and contraction of HIV if the exposure is there.
Another idea women and men in some cases get in their head is that age is an immunity. You start rethinking the use of a condom. In some cases of women, the condom was used to prevent pregnancy. And when you get to a certain age, that's probably not anything that you need to be worried about anymore. And so you don't have to use the condom, but we need to rethink sex in this day and age, and HIV is an infection that leads to AIDS and can kill. So the condom is very important, and we need to rethink using the condom for protection at all times.
Of course, the church's main position has always been abstinence, and that would be, of course, the obvious, position that the church would espouse. But as Paul said in his gospel, when he asked for those in the church of his day to be abstinents like him, the reality was everybody couldn't do that because that's a gift from God. So he said it would be better for you to marry than to burn. So then the church may have to, in fact, look at offering to people, I know this is very radical, but we talk about harm reduction, until people get to that point where they can make the change. To educate people about needle exchange programs, to educate people about using barriers, condoms, and other things to protect themselves until they come to that point where they're able to make the changes that we in the church want them to morally and ethically make.
There are several different barriers to protect yourself from infected bodily fluids, one being the latex condom, the female condom, and the dental dam. These barriers can protect you from HIV infection during anal sex, oral sex, and vaginal sex.
Signs of old age can sometimes mask HIV symptoms. At times, healthcare providers may not realize that seniors are at the same risk for HIV as younger populations. Professionals may be reluctant to discuss or question matters of sexuality with aging patients, and that results in individuals going undiagnosed.
I see you've been losing quite a bit of weight lately. How's your appetite?
Well, I haven't noticed any change in my appetite, but my mouth is so sore, I can hardly eat.
Is that right? Have there been any other changes?
Well, I don't sleep as well as I used to a few months ago, and getting out of bed in the morning is a real chore. What do you think?
Any aches, pains, soreness?
Well, I try to walk every evening, and sometimes my joints just stiffen up on me. Stiffen up, and I have to try to work it out. What do you think ails me?
Well, you know you're getting up in age, and sometimes as we age, we feel more aches and pains. I tell you what, I'm going to give you something for the joint pain and some dietary supplements, and we'll see how you feel the next time you come in, okay?
Okay.
Okay.
There's wasting syndrome that can make the diagnosis of AIDS. It's associated with HIV and primarily HIV, and the person loses weight and they're tired. So there could be in that The physician could be thinking, oh, my patient is elderly, is not eating, that's why they're losing weight. Whereas there really might have been a risk behavior.
If you know you are active sexually and you may have made some mistakes along the way, go to your doctor, get tested. It's better to know that you have the virus because there's a lot of medication out there today that can help you extend your life.
HIV is not a routine test. None of the evaluations for sexually transmitted diseases are really routine tests once the person gets over 50. So it's important to recognize that and know that some type of discussion needs to preface the conversation or thinking that leads to, well, let's do this test. You know, maybe there's a need for this particular test.
At the Detroit Health Department, we offer anonymous and confidential testing. This testing is free. There's no cost. Once a client is tested, within a week, they are able to come back and know the status of that test. And we test with a very simple method with the use of OraSure, which is a swab into the mouth of a person, and then within a week we are able to give them their results.
Testing is important because we know in all ages, and even with those over 50, the earlier one can get tested and identified to be infected, the earlier one can get treatment and the better the quality of life.
It's important to know how the disease is transmitted, but it's also important to prevent the spread. And one of the ways of preventing the spread of HIV is changing our behavior. Not only changing our behavior sexually, but changing our behavior overall. Stop stigmatizing this and saying that it's only this kind of disease, it only affects this kind of people. We need to look at it as a disease, and we need to put in preventions to stop the spread. And a lot of those preventions is our behavior, how we go about seeing the doctor, how we feel about testing, how we feel about the way we have sex. We need to change our behaviors so that we can live a lot longer. Early detection of this virus can assist in a much fuller life. And who knows, you may be around for the cure.
The most important things you can do are to know your body, know your partner, be true to yourself, talk openly with your physician, and if risk behavior is present, get tested for HIV.
For seniors, I would leave them with the message that for this epidemic, they are probably the key, because for many of the seniors, they can affect their children and grandchildren, and many of them their great-grandchildren. And if the senior population will open up and inform themselves, get tested, and encourage their daughters and sons, granddaughters, grandsons, and great-grands to get tested and to inform themselves and to begin to change their lifestyles, because they as seniors, who we say the older you get, the more difficult it is for you to modify and change your life. If seniors can do that, then they can play a major role in helping to educate those who are coming behind them. This is the only way this epidemic will be turned around in our community.
Like all Americans, individuals over the age of 50 who are sexually active are at risk of HIV infection. Among the many challenges that affect this population, HIV/AIDS awareness is the most urgent. Older Americans need to hear the message that HIV can affect anyone. Regardless of age, race, or ethnicity, gender, or sexual orientation, you can be at risk for HIV. If you have unprotected sex, heterosexual or homosexual, with someone who has HIV, you can be infected. If you share needles or syringes with an infected person, you can contract HIV. The best line of defense is to abstain from sex and drugs. If you are having sex, anal, oral, or vaginal, condoms or adequate sexual barriers should be used at all times. In the case of intravenous drug users, needles should never be shared or reused. Currently, there is no cure for HIV or AIDS, but today's treatments are helping people stay healthy for longer. Seniors can continue to have a healthy, active life and a satisfying sex life for many years to come. Some say age only makes it better. The key is for seniors to get tested for HIV and protect themselves at all times. More information can be found at
City of Detroit, Sexually Transmitted Disease Clinic, 313-876-4188. City of Detroit, HIV Counseling and Testing, 313-876-0980. CDC National STD and AIDS Hotline, 1-800-342-2437. National AIDS and STD Information Clearinghouse, 1-800-458-5231. CDC National Prevention Information Network, 1-800-458-5231. Michigan AIDS Hotline, 1-800-872-2437. AIDS Consortium of Southeastern Michigan Incorporated, 313-496-0140 or 1-800-826-1662. Or contact your local health department.